Hi, this is Dr. Silvester, and I'm going to talk to you a little bit about diabetes and exercise, and why exercise is such an important aspect of taking care of your diabetes. And I'm going to use an analogy. The analogy is called what I like to call the garage analogy. The problem with diabetes is that you get too much blood sugar inside your bloodstream. What that means is that if you draw blood, and that's what happens when you do the finger stick, you're drawing a little blood out and you measure the sugar in the blood. It gets too high. Now, sugar's not supposed to be in the bloodstream. It's supposed to move into a few cells, and the two major cells in your body that burn up blood sugar are, first of all, the brain, and second of all, the muscle mass. Now, the brain is a relatively small organ. It's only about this big, and it burns sugar at kind of a constant rate and doesn't really change much. But one thing that's interesting about the brain is people who have diabetes and are terribly, a little high, like 300, 400, when they get down to 100, especially if they do it over a short period of time, they start to feel really sick. The reason they're feeling sick is because their brain is telling their body that they're starving to death because the brain's used to 300. But if they keep it down for a couple of days, the brain gets used to 100 and starts going, hey, this is what we're really supposed to feel like, so that's good. Well, the other cell is the muscle cell. The muscle cell is a big organ, and it varies a lot in how much blood sugar it uses. So let's say the muscle cell is like a garage. Every garage, well, a garage outside the house, every garage has two doors. One where the people go through, and the other one is where the cars come through. The people door is controlled by a lock. Insulin is the key that opens that lock. You stick insulin in the keyhole and open the door opens, sugar goes into the garage, and let's say there's a fire inside the garage that burns the sugar. After about 10 minutes, that door shuts again and you need another key. So they give you pills like metformin, glipizide, glyburide, all that stuff, is to generally make your pancreas make more insulin. Now, when your pancreas get worn out, they give you injections of insulin. And there are some other medications that work a little different, but that's kind of in a nutshell of how insulin works. The problem with that key is that it doesn't just work on the garage. It goes over to the fat factory and opens that door too. So insulin is a growth hormone. It makes you fat. So you may notice that when you start controlling your blood sugar better by using elevated levels of insulin, you become a little overweight. You start putting on weight a little bit, or a lot. Now, the other door is the garage door. When you open that stays open for about 4 hours, and that's opened with exercise. Now, weightlifting, aerobic exercise, anything is helpful. But if you incorporate a little weightlifting, it can be more helpful. But if you open that garage door every day, a couple of other things happen. At least we think they happen. The first we're sure of is that the fire inside the garage burns hotter. Secondly, you make more garages, so that insulin has more places to work. Thirdly, we think that the lock on the other door gets less rusty, so you don't need so many insulin keys, so your need for insulin goes down, because the door opens a lot easier. It's been clinically shown that 30 minutes of exercise is more effective than any single pill you can take for your diabetes. So it's also good for everything else. So if you have diabetes, 30 minutes of exercise every day can make a huge difference in how the disease is controlled and how you feel. So my advice is get out there and do some exercise and you'll feel a lot better. One thing you can do to test yourself, especially if you have pretty high sugar, is check your blood sugar before you go exercise. Go do some exercise that makes you, as long as your doctor says it's okay, makes you breathe hard and makes you sweat a little bit, and then wait about 10 minutes after you're done, then check your blood sugar again. Usually it's down about 60 to 70 points. And so my dad always used to say, well, he still says, exercise cures everything, and in the case of diabetes, it probably does. Anyway, thanks for listening. Bye-bye.